X. Okay. So yesterday we learned what is ICD-10-CM. Okay. So what are the books used in ICD? In medical coding. Okay. So basics of history of ICD-10-CM and structure of ICD-10-CM and conventions and how many chapters in ICD-10-CM. Okay. So coming to conventions, yesterday we discussed general notes, inclusion terms, okay, and exclude one and exclude two. Okay. So exclude one and exclude two. So the next one is code first and use additionally. Okay. So certain conditions have both an underlying etiology and multiple body system manifestations due to the underlying etiology. Okay. So that means yeah. Okay. Code first and use additional. Okay. So the code first and use additional code. So I will tell you one example. Okay. So, yeah. For example, the patient comes for severe sepsis. Okay. So how to lead the diagnosis code for severe sepsis? Okay. So yeah. So how to lead the diagnosis code from severe sepsis? So what is the main term in severe sepsis? What is
Sepsis.
the main term in severe sepsis? Generally, so we will discuss what is sepsis, what is severe sepsis in next class. So the sepsis topic is very, very, very important in inpatient coding. Okay, so the sepsis topic is very important in inpatient coding. So most of these times, so the lot of questions they are asking in this topic, the sepsis topic. So the sepsis topic is very, very important in live coding and interview pattern also for particularly in inpatient code. Okay. So the severe sepsis. So the sepsis is the main term. Okay. So the sepsis is the main term. In sepsis, severe is the subterm. Okay. So go to severe. Okay. In sepsis, severe. Okay. So the code R65.20. Okay. So the code is R65.20. But in R65.20, one specific guideline is there. Code first, underlying infection. Okay. And use additional code. Another guideline also is there. Okay. So the instruction like, so this is one of the convention. Okay. So what is code first means? When the patient comes to the severe sepsis, so that time by default, two codes required. Okay. So you can code first these conditions. For example, the severe sepsis following a procedure. Okay. For example, the patient had previous surgery, so some days back or some years back. Okay. For example, appendectomy is done, so 10 days back. Okay. Now the patient comes for severe sepsis. So the severe sepsis.
Hello. Sir,
Hello.
maybe
Hello.
you are
Hello.
on mute.
The voice is not
Sorry, I'm
audible.
in mute. Yes, yes,
Good
yes.
morning, everyone.
Yeah. Okay. Sorry, yes. So the next convention is so code first and use additional. Okay. What is code first and what is use additional? Okay. So the code first means like I will show. Okay, so the code first means, so the patient admitted to the hospital for severe sepsis. Okay, so what is the main term for severe sepsis? I will tell you what is mean by severe sepsis. So the next topic. Okay, so the next topic is infections and parasitic diseases. So in that infections and parasitic diseases, we learn HIV, AIDS guidelines and sepsis guidelines. Okay, so the sepsis is very, very, very important in inpatient coding. Okay, so the sepsis topic is very important in inpatient coding. Okay, so that is very challenging also. The sepsis topic is very, very difficulty and very challenging. Okay, but I will tell you in simple method. Okay, so in sepsis topic, generally the sepsis is blood infection. Okay, so the sepsis is blood infection. So the severe sepsis means any acute organ failure is due to that infection. Okay, for example, the acute respiratory failure or acute kidney failure or acute liver failure.
I didn't meet her. Voice is not audible. Hello. Hello.
1 second. So I don't know. Hello.
Okay, sir.
Hello. Yeah.
Yes, yes, yes.
So I don't know why it's automatically muted in my mic. So I don't know. So I will check.
Okay.
The class is not audible in starting onwards.
No, sir. Just now only. But in middle of the it's clear. Yes.
Okay.
Today.
Sorry, guys. So I think some network issue. Okay. Yeah. So the next one is the next convention is code first and use additional codes. Okay. What is code first and what is use additional? Okay. So the code first note means like, so for example, the patient comes for severe sepsis. Okay. So the patient comes to the hospital for severe sepsis. Okay. So how to lead the diagnosis code for severe sepsis? Okay. So what is the main term for severe sepsis?
Sepsis. Sepsis.
Sepsis. Okay. So the sepsis is the main term. So you can check. Yeah. Go to sepsis. Okay. Go to sepsis. So the sepsis is the main term. Okay, so this is alphabetic index. Okay, so this is alphabetic index. So this is volume 2. Okay, so this is like English dictionary. Okay, you can check for the sepsis. So this is severe sepsis. Severe sepsis, that is S series. Okay, so this is P series. Next, S series. So in S series, severe sepsis, the code is R65.20. So please click this R65.20. Okay, so in R65.20, the code description is severe sepsis without shock. Okay, so severe sepsis without septic shock, that is R65.20. But above R65.20, one specific coding guideline is there. So that is code first underlying infection such as. Okay, code first underlying infection such as. Okay, so infection following a procedure. Okay, infection following a procedure means basically the sepsis is blood infection. Okay, what is mean by sepsis means, so the sepsis is blood infection. Okay, so the infected blood is circulated throughout the body. Sometimes some organs are affected for this infection. Okay, so that time the organ is completely failed. Okay. For example, so the patient comes for respiratory failure. So the acute respiratory failure due to sepsis. So that type of sepsis is called as severe sepsis. Okay, so I will tell you what is the exact definition for severe sepsis in sepsis topic. Okay, so maybe tomorrow or day after tomorrow we will start that topic. So the sepsis. So the sepsis topic is very important role in inpatient coding. Okay, and so definitely in interview pattern, so they are asking at least 2 to 3 questions per sepsis topic. Okay, so in live coding also, so we are seeing daily basis maximum 3 to 5 charts per sepsis. Okay, so the sepsis is very important topic in inpatient coding. Okay, so we will discuss in detail in that specific chapter. So in coming classes. Okay, so in severe sepsis, so the code first guideline means the code first underlying infection such as infection following a procedure. Infection following a procedure means so the severe sepsis due to following any procedure. That means the patient had hysterectomy done 10 days ago, or so the patient had appendectomy surgery so 3 weeks ago. Now the patient admitted to the hospital because of sepsis. So the cause of sepsis is due to the underlying cause of sepsis is due to that surgery. Okay. So that time we can give the T81.4 series as the primary code. Okay. And you can give additional code for severe sepsis R65.20. Okay. Next, infection following. So this is a complication, guys. Okay, so the in ICD 10 cm, so we will discuss this post-operative complication topic. So that is final topic. Okay, so we will discuss in the ICD end of the class for post-operative complication. So that time we will discuss in detail. So what is mean by complication? What are the types of complication? What is intraoperative complication? What is postoperative complications? Okay, so we will discuss in detail. Okay, next, infection following infusion, transfusion, and therapeutic injection. Okay, so that means the severe sepsis following infusion. Okay, so the severe sepsis following blood transfusion. So the severe sepsis following any therapeutic injection. Okay, infusion, injection, or blood transfusion. Okay, so the sepsis source is because of any injection. So the sepsis source is the severe sepsis source is infusion. So the severe sepsis following blood transfusion. So that time you can give the complication T80.2 series is the primary code, and you can give additional code for severe sepsis. Okay, so and purpureal sepsis. Purpureal sepsis means, okay, so what is mean by purpurium or postpartum? Okay, so the purpureal period or postpartum period, both are same. Okay, so do you know what is purpurium?
Delivery
What
after
is
6 weeks.
okay? So after delivery, okay, the next coming 6 weeks we can consider as postpartum or purpurial. Okay, for example, the patient is delivered 2 weeks ago. Now the patient comes for severe sepsis. Okay, in that scenario, you can give the O85 as the principal diagnosis and R65.20 is the additional diagnosis. Okay, so that is code first. Code first means that time you can give the following any code based on source of severe sepsis. Otherwise, so the severe sepsis, only the physician documented severe sepsis. So there is no documentation. The source of sepsis like following procedure or following infusion or following blood transfusion or following pregnancy or following purpurial or nothing. Okay, only the physician documented simply severe sepsis. So that time you can give the first code is sepsis A41.9, and you can give additional code for R65.20. Okay, so the severe sepsis by default 2 codes required. Okay, so I will show you how to lead the diagnosis. Okay, in 3 severe sepsis. Okay. Yeah. So add diagnosis. Okay, so sepsis. Okay, severe. Okay, so the option is C. Okay, sepsis severe, the option is C. Okay, so other are unspecified. Okay, so there is no documentation of post procedure. Okay, so other are unspecified. Okay, so sepsis. Okay, so the sepsis type is so continue unspecified. So associated drug resistance. Okay, so do not wish to code. Okay, and no are already coded. Okay, the option is 2 and no procedures. Okay, see by default 2 codes required. Okay, because in R65.20 go to instructional notes. In that instructional notes, code first notes is there. Okay, so that's the reason we can code A41.9 as the principal diagnosis and R65.20 as the secondary diagnosis. Okay, understand what is mean by code first? Okay, so
Okay.
any code, okay, so you can check in tabular list. Okay, in tabular list, any instruction is given code first means so that time by default 2 codes. Okay, so the first code has the principal diagnosis and the second code is secondary diagnosis. Okay, so 1 second, guys. See the variation. Okay, so the sequencing also very important. Okay, for example, you are given A41.9 as PDX. So that time the dollar value, okay, the bill amount is like $4,862. Okay, but you are given like R65.20. Okay, so this is unacceptable PDX, guys. Okay, so that time they are given some error. Okay, so sequencing of code report should be in the following A41.9 and R65.20. Okay, so that time it's showing some edit. Okay, so according to Medicare code edit, the principal diagnosis R65.20 is unacceptable. Okay, so for example, you are given, so that time it's showing some error. Okay, you are given this one as the PDX, so that time the dollar value is very high, but so that is illegal. Okay, that is not correct. Okay, so that's the reason first you follow the basic fundamentals of coding guidelines, like so the code first notes. Okay, so that's the reason the severe sepsis is documented by default 2. Okay, next one, huge additional. Okay, so huge additional code means general guideline. Okay, so I will show you. Okay, for example, encephalopathy due to sepsis. Okay, the encephalopathy due to sepsis. Okay, so the encephalopathy, what is mean by encephalopathy?
It's a disease or brain disorder or malfunction of.
Okay, so the encephalopathy means that is dysfunctioning of brain. Okay, so that is brain dysfunction. Okay, so that is organ dysfunction. Brain is the organ, so the organ dysfunction due to sepsis. Okay, that is severe sepsis. Okay, so any acute organ failure or any acute organ function related to sepsis, that is severe sepsis. So that time I will tell you so how to lead. For example, sepsis. Okay, sepsis. Okay, severe. Okay, why we can consider as severe sepsis means the encephalopathy due to sepsis. Okay, that time we can consider as severe sepsis. In severe sepsis, sorry, yeah. So the type of sepsis is not documented. We can consider as unspecified. So see, severe sepsis. Okay, the severe sepsis with acute organ dysfunction specified as. What is the organ dysfunction specified as? So hepatic failure or encephalopathy or renal failure or respiratory failure. Okay, in this example, we we are given encephalopathy. So that time you can lead encephalopathy. Okay, so do not wish to code. There is no other acute organ failures. Okay, so 2, no procedure. See, that time by default 3 codes. Okay, that time by default 3 codes. Okay, so encephalopathy due to sepsis. Okay, so that type of sepsis we can consider as severe sepsis. Okay, that time we can consider, so that is severe sepsis. Okay, why we can consider as severe sepsis means as per guideline severe sepsis means any acute organ failure or acute organ dysfunction due to sepsis. So that type of sepsis is called as severe sepsis. Okay. When severe sepsis is documented, by default two codes. The first code sepsis. Okay. And the second code is severe sepsis R65.20. Okay. And you can give additional code for the organ dysfunction. The encephalopathy due to sepsis, that is the type of encephalopathy, is considered as metabolic encephalopathy. Okay. So the code is G93.41. Okay. The unspecified encephalopathy code is different, but this is considered as metabolic encephalopathy. Why we are considered as metabolic encephalopathy means the encephalopathy due to sepsis. Okay, so that's the reason we can consider as metabolic encephalopathy. So the metabolic encephalopathy code is G93.41. As per coding conventions, okay. So in severe sepsis, huge additional code one note is there. Okay, in huge additional code, so encephalopathy is there. So the code is G93.4. Okay, so that's the reason we are given three codes in this exam. Okay, so when severe sepsis, by default two codes, the first code is sepsis and the second code is severe sepsis. And you can give additional code for the specific acute organ dysfunction or acute organ failure, because huge additional code note is there in severe sepsis. Okay, so the huge additional code means you can give this condition code as additionally along with severe sepsis. Okay, so that's the reason the sequencing is very important role in ICD-10-CM. Okay, especially in inpatient visits. Okay, so the sequencing also very important. Okay. Understand what is code first and what is huge additional code?
Yes.
Okay.
Yes.
Next one. My God, the section is. Yeah, code first we complete, and so code also. Okay, so code first and huge additional code. So we completed. Next, code also. Okay, code also notes means in ICD-10 10CM indicate that two codes may be required fully describe a condition. Okay, for example, insomnia due to medical condition. So the instruction notes, for example, in G47.01. Okay, so G47. So G47.0. Okay, so G47.01 means insomnia due to medical condition, that so they are instructed code also associated medical condition. Okay, so for example, the insomnia due to dehydration. Okay, so now the patient comes for sorry. Now the patient comes to the hospital for insomnia. So after evaluation of the physician, so the physician confirmed as the insomnia is due to dehydration. So that time you can code G47.01 insomnia due to medical condition, and you can give additional code for dehydration. Okay, so that is code also. Okay, code first, use additional code, and code also. Okay, so abbreviation. So these are the very important in interview pattern. What is NEC and what is NOS? Okay, so NEC means the full form for NEC is not elsewhere classified. Okay, the NEC full form is not elsewhere classified. The NOS full form is not otherwise specified. Okay, so I will tell you. Okay, for example, sepsis. Okay, so sepsis is documented. So that time the sepsis code A41.9. Okay, so in A41.9, so under A41.9, septicemia, NOS. Okay, so the NOS means not otherwise specified. Not otherwise specified means unspecified. Okay, so what is NOS means? The NOS full form is not otherwise specified. Okay, what is mean by not otherwise specified means unspecified. Okay, only the physician documented sepsis. Okay, the sepsis unspecified. Okay, so there is no specific documentation for So the type of sepsis. Okay. So the physician not documented the specific type of sepsis. Okay. That time you can give NOS, not otherwise specified. That is unspecified. Okay. NEC means not elsewhere classified. Okay. Not elsewhere classified means other specified. Other specified means, for example, in sepsis, okay, for example, in sepsis, okay. So, for example, E. coli sepsis is documented. Okay. So, the sepsis due to Escherichia coli. Okay. So, that time you can see sepsis, okay, due to E. coli. Okay. Sepsis due to Escherichia coli. Okay. So, the code is A41.5. Okay. So, the code description, see, the A41.51 is sepsis due to Escherichia coli. Okay. For example, the sepsis, MRSA sepsis. Okay. So the physician documented MRSA sepsis. What is full form of MRSA?
Methicillin resistant staphylococcus.
Yeah. MRSA means methicillin resistant staphylococcal aureus. Okay. So the MRSA full form is methicillin resistant staphylococcal aureus. Okay. For example, in sepsis, okay, go to MRSA. Okay. In sepsis, MRSA, the code is A41.0. Okay. For example, the physician documented MSSA sepsis. So that time the code is A41.0. Okay. For example, the physician documented gram negative sepsis. Okay. So that time the code leads to A41.50. But the physician documented gram positive sepsis. So the physician documented gram positive sepsis. Okay. So any code is available for gram positive sepsis?
No, sir.
No.
Okay. The gram negative sepsis, one code is there. E. coli sepsis, one code is there. MRSA sepsis, one code is there. MSSA sepsis, one code is there. But the gram positive sepsis, there is no specific. So that time you can consider as other specified sepsis. Okay. That time you can consider as specified. Okay. So go to specified. Okay. Go to specified organism. So that is NEC. NEC means not elsewhere classified. Not elsewhere classified means other specified. Okay. So the physician documented more specific sepsis, but the specific type of sepsis code is not available. So that time we can consider as other specified sepsis. Okay, so the other specified sepsis, that is NEC. So the code is A41.89. Okay, so the A41.89 is other specified sepsis. Okay, understand what is NEC and what is NOS?
Yes, sir.
Okay, NEC means not elsewhere classified. Not elsewhere classified means other specified. Okay, NOS means not otherwise specified. Not otherwise specified means unspecified. Okay, clear? NEC and NOS.
Yes, sir.
Yes, sir.
Okay. So next, cross reference notes. C also C category line. Okay. C also C category means, for example, okay. So coronary artery disease. Okay. What is the main term? Coronary artery disease. How to lead this diagnosis? What is the main term?
Disease.
Disease is the main term. Okay. So go to disease. Okay. So in disease, okay, disease, okay. So coronary artery, for example, disease coronary artery. Go to coronary. Okay, C series. Okay. So yeah. So disease coronary artery. So that time they are given C notes. Okay. So just we see that C. What is mean by C? Okay. So disease coronary means, so that time they are given one instruction. C disease heart ischemic atherosclerotic. Okay. C disease heart ischemic atherosclerotic. So that time you can go with disease, heart, ischemic, atherosclerotic. Okay, so otherwise you can click. So that time, so disease, heart, ischemic, atherosclerotic. Okay, so the code is I25.10. Okay, so the coronary artery disease. Okay, so the diagnosis code is I25.10. Okay, so at the time of book reading, so they are given some instructional notes like C also, C category like that. Okay, so that time, what are the instructions they are given in that specific code list? So you can follow that instruction. Okay, so in this instruction, in disease coronary artery, so that time they instructed go to disease heart, ischemic, atherosclerotic. So that time we can go with disease heart, ischemic, atherosclerotic. So that time the code leads to I25.10. Okay, so that is C also, C category also same thing. Okay, C also, C category also same thing. Okay, so next. Okay, so okay. Sometimes, like I will show you. So in dementia, in bracket, okay, so some slanted brackets are there, right? In dementia, okay, in bracket like degenerative, primary, persisting dementia, unspecified severity dementia, dementia without behavioral disturbance, dementia psychotic disturbance, dementia mood disturbance, dementia and anxiety. Okay, for example, okay, so the physician documented only dementia. So that time the code is F03.90. Okay, for example, degenerative dementia is documented. So that time also you can give same code. Primary dementia is documented. That time also you can give same code. Unspecified severity dementia is documented. That time also you can give same. Okay, so what is this brackets and what is these words means? Okay, so the terms in parentheses are known as non-essential modifiers. Okay, so they're asking like what is non-essential modifiers? Okay, what is non-essential modifiers? Okay, so the non-essential modifier means the terms in parentheses. So the terms in parentheses are known as non-essential modifiers. So the terms in parentheses, okay. So the terms in parentheses are known as non-essential modifiers. Okay. So like, for example, pneumonia. Okay. For example, pneumonia. I will show you one more example. Okay. So in pneumonia also, okay, in brackets, okay, these brackets, okay, so these brackets called as parentheses, okay, these brackets called as parentheses, okay, so these terms, okay, like for example, only simply pneumonia is documented that time, the diagnosis code J18.9. Even acute pneumonia is documented, that time also you can use same code. Double pneumonia is documented, that time also you can use same code. Migratory pneumonia is documented, that time also you can use same. Okay, so what is mean by non-essential modifier means the terms in, okay, these terms, okay, the terms in parenthesis. Parenthesis means these type of brackets. Okay, so the terms in parenthesis are known as non-essential modifiers. Okay, so the terms in parenthesis is known as non-essential modifiers. Okay, so these are the parentheses. Okay, and so essential modifiers are listed as subterms in the alphabetic index, not in the parentheses. Okay. So what is essential modifier? What is non-essential modifier means? Essential modifiers are listed as subterms in the alphabetic index, not in the parentheses. But the non-essential modifier, in contrast, words in parentheses are non-essentials and do not affect the code assignment. Okay. So they are given some examples. Okay. Square brackets, square brackets. Okay, so I will show you one example. So dementia due to HIV or AIDS, for example. For example, dementia and Parkinson's. Okay, Parkinsonism with dementia. So that time, see, some brackets are there. Okay, so in brackets, one specific code is there. So in that code, for example, in this bracket, so they are given F02.80. Okay, for example, the patient had dementia along with Parkinsonism. So that time we assign two codes. The first code G20.A1. So that is Parkinson, G20.A1, that is Parkinson's disease. And you can give additional code for F02.80. So in this bracket, this code is manifestation code. So the manifestation never used as principal diagnosis. Okay, so in this bracket code, what are the diagnosis code in the they are given in these brackets. Okay, so these codes never assigned as PDX level. Okay, so these codes always secondary diagnosis. So these are manifestation. Okay, what is mean by manifestation? Yesterday we learned etiology. Etiology means underlying cause of disease. So what is mean by manifestation?
Due to underlying cause.
Sorry.
Results of condition.
Disease caused by the specific condition.
Yes, good. Okay. So disease caused by the specific condition. Okay. Disease caused by the specific condition, that is called manifestation. Okay. Disease caused by the specific condition. Okay. For example, the diabetes due to lung cancer. Okay. So the diabetes is the endocrine disorder disease. Okay. So our diabetes ela ochindi. What is the cause of diabetes ante? So the diabetes is due to brain metastasis. Okay, the diabetes is due to brain metastasis. Okay, so that is okay manifestation. Okay, the manifestation. Okay, the manifestation means underlying cause of disease. Okay, underlying cause of disease, that is manifestation. The manifestation never used as PDX level. Okay, so the manifestation never used as PDX level. So the other thing, so that is not important. Next, relation terms end and with. Okay, so when end means that time you can give both conditions separately. With means, so the word with should be interpreted to mean associated with or due to with. Okay, so for example, so diabetes. Okay, in diabetes, in with. Okay, so in diabetes with, so many conditions under with. Okay, so that time, for example, the patient comes for gangrene. So the patient comes for chronic kidney disease. Okay, so that time the patient had diabetes. So that time by default you can consider as complication of diabetes. Okay, so why we are considered as complication of diabetes by default? These conditions means as per with guideline. Okay, with guideline means due to with or associated with. Okay, due to with or associated with. Okay, so that time the physician not mandatory relationship is not mandatory between. Okay, so these two conditions. Okay, for example, patient ఇప్పుడు diabetes తో వచ్చాడు మనకి, ఆ పేషెంట్ కి క్రానిక్ కిడ్నీ డిసీజ్ ఉంది. ఓకే, సో అప్పుడు ఫిజిషియన్ మనకి డయాబెటీస్ విత్ క్రానిక్ కిడ్నీ డిసీజ్ అని చెప్పాల్సిన అవసరం లేదు. బై డిఫాల్ట్, so you can consider as diabetes with CKD by default combination. So that time they are given huge additional code to some specific guideline. Okay, so that time they are given huge additional code to identify the stage of chronic kidney disease. So that time we can assign CKD separately along with this combination. Okay, so that is with. Okay, so n means we can code separately placeholder. Okay, so what is placeholder and what is use of placeholder in ICD-10? Okay, so the placeholder is X. So the purpose of placeholder is, I will tell you. Okay, for example, traumatic cervical fracture, initial encounter. Okay, so traumatic cervical fracture, initial encounter. Okay, so what is the main term? What is the
Fracture.
main term? Fracture. Okay, so fracture, go to fracture in book. Okay, so this is like book leading. Okay, in fracture, traumatic. Okay, so there are so many types of fracture: burst fracture, chronic fracture, insufficiency fracture, non-traumatic fracture, pathological fracture, traumatic fracture. So in this example, so I given traumatic fracture. Okay, so that time you can consider fracture traumatic. Okay, fracture traumatic. Okay, so cervical. Okay, what is the site of fracture? Cervical. Okay, cervical. Go to cervical. A, B, C. Okay, C, cervical. Okay, cervical C. So they are saying C fracture vertebra cervical. Okay, so that time you can click this C fracture. Okay, vertebra. Okay, cervical. So the code is S12.9. Okay, so in S12.9, okay, so they are saying the appropriate seventh character is to be added to code S12.9. Okay, so generally the code is S12.9. Okay, S12.9. Okay, so how many digits? S12.9, how many characters? How many characters?
4 characters.
S1.
Four characters.
characters.
Okay, 4 characters. So they are given seventh character value here. Okay, so the appropriate seventh character is to be added to code S12.9. A is initial encounter, B is subsequent encounter, S is for sequela. Okay, so we will discuss in detail. So in coming chapters, okay, what is initial, what is subsequent, and what is sequela. Okay, so in this example, so it is documented as initial encounter. Initial encounter means, so that is A. Okay, so the A is, okay, seventh character. Okay, so the A is S12.9. So the seventh character A. Okay, so there is no fifth character, there is no sixth character. Okay, in place of fifth and sixth characters, you can assign placeholder X. Okay, so that time you can select the option A. So for example, see the code S12.9 XXA. Okay, so the complete code is S12.9 XXA. Okay, S12.9 XXA. So the X is placeholder. So the purpose of placeholder is future extension purpose. Okay, in coming future, so in place of X, so they are added one or two some numeric character. Okay, so that is the use of X. Okay, so the X is placeholder. Okay, so they're asking one question simply: what is placeholder and what is the use of placeholder in ICD-10C? Okay, so the placeholder is X, so that is used for future extension purpose. Okay, understand guys, what is X and what is the role of X in ICD-10 coding?
Yes.
Thanks. So that is enough. Okay, so remaining combination codes we will covered in chapter specifications. Okay, so and the next one. Yeah. So yeah. First, what is sign and what is symptom? Okay. So the sign means objective evidence of disease observed by the examining physician. Okay. I should have back laptop charger on this. So the sign means objective evidence of disease observed by the examining physician. That means what is the specific diagnosis confirmed by the physician, that is called sign. Okay. The symptom means subjective observation reported by the patient. Okay. Charger rana, laptop charger. Back this subjective. Okay, so the symptom means subjective observation reported by the patient. Okay, at the time of hospital, so the patient comes for some symptoms like, so the patient comes for abdominal pain, nausea, vomiting, some knee pain. So that time the physician evaluated, okay, so for the specific patient, and they finalized one specific diagnosis after evaluation. Okay, what is the root cause? What is the underlying cause of these symptoms? Okay, that is sign. Okay, for example, the patient comes for abdominal pain, that is symptom. Okay, so the physician diagnosed as acute appendicitis, so that is sign. Okay, as per guideline. Okay, so the symptom is the integral part of definitive diagnosis. Do not quote symptoms separately along with definitive diagnosis. Okay, so the symptom is the integral part of disease. Okay, so do not quote separately symptoms along with definitive diagnosis. Okay, for example, the patient comes for shortness of breath, fever, so and the physician confirmed as pneumonia, so that time you can code only for pneumonia. Okay, so do not code for symptoms along with definitive diagnosis. Okay. Understand, guys? You can understand that is very important guideline for all chapters. Okay, so as per signs and symptoms, okay, so the symptom is the integral part of definitive diagnosis. Do not code separately unless the symptom etiology is unknown. For example, the patient comes for abdominal pain. Okay, so the final impression, Vaishu, mute petkona, Vaishu, sound the need. Yeah. So the patient comes for abdominal pain and the physician diagnosed acute appendicitis, gastritis, and diverticulitis, and abdominal pain also is documented. Okay. In that impression, the physician is documented like, so the abdominal pain unknown etiology. Okay. So the physician also, so not confirmed like what is the exact etiology for abdominal pain. Okay, so the patient had appendicitis, the patient has gastritis, the patient had gastric ulcer also. Okay, even the patient had gastric cancer also. But so the physician not confirmed what is the exact etiology for abdominal pain. So that time you can assign symptom. Okay, so that time you can quote symptom also. Okay, but as per guidelines, signs and symptom, so the symptom is the integral part of definitive diagnosis. Do not quote separately unless the symptom unknown etiology. Okay, unless the symptom cause is unknown etiology. Okay, so coming to first chapter. Okay, so the first chapter is infections and parasitic diseases. Okay, in infections and parasitic diseases, okay, so we learn mainly two topics. One is HIV and AIDS. Okay, so the next one is sepsis. Okay, so coming to HIV and AIDS, what are the common symptoms of AIDS? Okay, what are the common symptoms of AIDS? Okay, so the common symptoms of AIDS is fever, muscle pains, headache, sore throat, night sweats, mouth sores, including yeast infection like oral thrush. Okay, so and lymph node swelling and diarrhea. Okay, so these are the common symptoms for AIDS. Okay, so in AIDS, one specific diagnosis code is there for AIDS. Okay, so at the time of AIDS, do not assign these symptoms additionally with AIDS. Okay, because these symptoms are integral part of AIDS. Do not code separate. Okay, so these are all integral part of AIDS. Do not quote separately. Okay. So the common test for HIV. Okay. So for example, the patient comes for HIV lab test. So that time the physician commonly performed this test. Okay. So the test is ELISA. Okay. So the ELISA test is positive for HIV. So that time we can assign one specific diagnosis code. Okay. So the ELISA means enzyme linked immunosorbent assay. Okay. In this test, mainly they're looking for CD4 count. Okay, so based on CD4 count, so the physician confirmed the patient had HIV or AIDS. Okay, so the both are different. Okay, not same. The HIV and AIDS both are different. Okay, so there is difference between HIV and AIDS. Okay, so there is a difference between HIV and AIDS. Okay, HIV is just infected but not developed the disease. So that time we can code only for HIV infection. Okay, so HIV is just infected, but not sorry, but not developed the disease. So that time we can code only HIV infection. So the HIV infection code is G21. Okay, the HIV infection code is G21. So the physician statement like HIV infection, asymptomatic HIV or HIV positive. Okay, so one of the interviewer asking like these questions. Okay, HIV positive, what is the diagnosis code? Okay, asymptomatic HIV, what is the diagnosis code? Okay, so our symptomatic HIV, what is the diagnosis code? So we will discuss later. Okay, so please remember these guidelines, guys. So this is very, very important. So in AIDS, mainly the importance is, so the HIV infection code is G21 and the AIDS code is B20. Okay, so the main concept is when to assign B20 and when to assign G20. Okay, so the physician statement like HIV infection or HIV positive or asymptomatic HIV. So that time we can assign G20. Okay, but the physician statement like so HIV disease or symptomatic HIV or HIV like illness or HIV/AIDS or AIDS. Okay, acquired immunodeficiency syndrome. The AIDS full form is acquired immunodeficiency syndrome. So the HIV full form is human immunovirus. Okay, so ARC, the physician statement like ARC. ARC means AIDS related complex. Okay, so in this statement, any statement is given in the medical record. So that time directly you can assign B20. Okay, so HIV disease or symptomatic HIV or HIV like illness or HIV/AIDS or AIDS. AIDS means acquired immunodeficiency syndrome or acquired immune deficiency syndrome. Okay, any statement. So or ARC. Okay, ARC means AIDS related complex. So that time you can assign B20. Okay. So coming to next guideline, okay. So when the patient admitted for AIDS related condition, the AIDS B20 as the principal diagnosis and the related condition, that is manifestation, as the secondary diagnosis. Okay, so this is very, very important guideline, guys. Okay, so this is the main important guideline in inpatient for AIDS topic. Okay, so the AIDS. Okay, so when the patient admitted for AIDS related condition, the AIDS as the principal diagnosis, the AIDS B20 as the principal diagnosis, the related condition, the manifestation code as the secondary diagnosis. Okay, the common AIDS related conditions. Okay, what are the common AIDS related conditions? Okay, sepsis, pneumonia, kyphosis, sarcoma. So generally the sepsis is the blood infection. Pneumonia is the lung infection. Kyphosis, sarcoma. So the kyphosis sarcoma is the most common skin cancer in AIDS patient. Okay, so the kyphosis sarcoma is the most common skin cancer in AIDS patient. Next, TB. TB means tuberculosis, and CMV, cytomegalovirus, and pneumocystitis carini, and candidiasis. Candidiasis means that is fungal infection. Okay. So these are the common, sorry, these are the common AIDS related conditions. Okay. For example, the AIDS patient admitted to sepsis. Okay. So the AIDS patient admitted to the sepsis. Okay. So that time the physician must and should document it. So the sepsis is due to AIDS. Okay. Physician man cheppali. Okay. Now the patient, okay, already AIDS patient. AIDS is the chronic condition. Okay, the AIDS is chronic condition. Lifelong, so the AIDS is not resolved. Okay, AIDS అనేది ఎప్పటికీ రిజాల్వ్ అవ్వదు. ఓకే, అయితే మనకి ఏ టైంలో పేషెంట్ వచ్చినా ఆ ఎయిడ్స్ పేషెంట్ హాస్పిటల్కి వచ్చినా వీ కెన్ అసైన్ ఎయిడ్స్ కోడ్. బట్ దట్ టైం, సో వెన్ టు అసైన్ ప్రైమరీ లెవెల్, వెన్ టు అసైన్ సెకండరీ లెవెల్. Okay, when to assign AIDS as the principal diagnosis, when to assign AIDS as the secondary diagnosis. Okay, so when the patient admitted for AIDS related condition, so the AIDS B20 as the principal diagnosis and the related condition as the secondary diagnosis. Okay, for example, okay, for example, so the AIDS patient, okay, at 25 years, okay, so at 25, sorry. A 25 years AIDS patient admitted for fever, headache, vomiting. Okay, or so headache, syncope. Okay, and the final and the discharge diagnosis it is documented as sepsis due to AIDS. Okay, so in this example, what is the PDX?
B20 PDX.
A 25 years AIDS patient admitted to fever, headache, syncope, and the discharge diagnosis, it is documented as sepsis due to AIDS. What is the PDX in this case?
B20
AIDS.
B20
Okay, so B20. Okay, so the B20 AIDS has the principal diagnosis. Okay, and you can give additional diagnosis code for sepsis. Okay, so do not assign fever, headache, syncope, because so the fever, headache, syncope, these are all the symptoms. Okay, so the fever, headache, so these are all the symptoms. 1 second, guys. Hello. Yeah, already. In class లో ఉన్నాను, ఒక హాఫ్ అన్ అవర్ లో కాల్ చేస్తాను. ఓకే, యా, సారీ. In this case, the AIDS has the principal diagnosis B20 and you can assign sepsis. Okay, so you did not remember the diagnosis code, so that time you can read so the sepsis code like so. Yeah, sepsis. Okay, so the code is A41.9. Okay, so the sepsis code is A41.9. Okay, you can assign sepsis as the secondary diagnosis. Okay, so the sepsis as the secondary diagnosis. Wait. Okay, for example, so the physician is not documented like so the sepsis is due to AIDS. Okay, only the discharge diagnosis, it is documented as sepsis only. Okay, in this case, you can assign AIDS as PDX.
No.
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 Okay, because the patient comes for sepsis. Okay, sepsis generally AIDS related condition, but the physician must and should document it relation between the condition due to AIDS. Okay, any condition, Okay, the AIDS patient comes for any condition. So that condition is related to AIDS. So that time only you can give the AIDS as the principal diagnosis. Okay, that condition is not related to AIDS. So that time do not assign AIDS as PDX. Okay, so in this scenario, you can give the sepsis A41.9 as the PDX and B20 as the second. Okay, very, very important. Nice. Next guideline, the patient admitted for AIDS unrelated condition, the unrelated condition as the principal diagnosis and AIDS as the secondary diagnosis. Okay, so the AIDS patient admitted for AIDS unrelated condition, like for example, the AIDS patient involved in motor vehicle accident and they found some fracture. Okay, fracture of wrist. Okay, so that's the reason the patient admitted to the hospital. Okay, so the fracture is not related to AIDS. So that is AIDS unrelated condition. Okay, now the reason for admission to the hospital is fracture only. So in that scenario, you can give the fracture as the principal diagnosis and the AIDS as the secondary diagnosis. Understand? The patient admitted
Yes,
for
sir.
AIDS unrelated condition, the unrelated condition as the principal diagnosis and AIDS as the secondary diagnosis. Okay. So next guideline, screening for HIV. Okay. So screening for HIV means, so the patient don't know they have AIDS or not. So that time the patient comes for HIV lab test. Okay. So when the patient admitted for HIV lab test, so that time you can assign G11.4 as the PDX level. Okay, the screening could always PDX. Okay, so that time you can search like screening. Okay, so screening for HIV. Okay, human immunovirus line. Okay, so yeah, see. Screening for HIV, human immunovirus. Okay, so the code is G11.4. Okay, so this is screening for HIV or lab test for HIV. Okay, next counseling for HIV. So the physician is given some counseling. Okay, at the time of sex, must and should you can use condoms like something. So that time the physician is given like the type of counseling. So that time you can assign G71.7. So that time you can go directly counseling. Okay, counseling for HIV. So G71.7. Okay, screening for HIV, G11.4, counseling for HIV, G71.7. Okay, so inconclusive HIV or serological test for HIV or non-conclusive HIV. Okay, so the patient comes for HIV lab test, but the lab test result is not confirmed, like the test result is positive or negative. Okay, so the test result is not confirmed, like, so the patient had HIV positive or negative. So that time we can assign R75. Okay, that is inconclusive HIV or serological test for HIV. Okay, అంటే ఆ హెచ్ఐవి టెస్ట్ లో వాడికి కరెక్ట్ గా తెలియట్లేదు అది పాజిటివ్ నెగిటివ్ రిజల్ట్ అని. Okay, so that time we can assign R75. Okay, so these are very, very rare. So generally, so we are not using the G series codes in inpatient settings. Okay, most of the times we are using B20 or G20. Okay, so based on this chapter specification, okay, so today I will give some examples. Okay, so today I will give some examples. Sorry. So I will share these examples in both. Okay, like for example, candidiasis of esophagus opportunity secondary to AIDS-like disease. Okay, so what is the PDX in this case? In this example,
AIDS.
AIDS. What is the diagnosis code for AIDS?
B20.
B20. So that time you can assign B20 and you can give additional code for candidiasis of esophagus. So that time you can go directly candidiasis here. So 1 second, guys. Okay. So how to open this software, like I will show you. Okay. You can open in Google browser. Okay. In your mobile or laptop or PC. Okay. So you can type like smart ICD-10. Okay. Smart ICD-10. Okay. You can enter, you can click smart ICD-10 first link. Okay. So that time automatically open like this window. Okay. For example, candidiasis of esophagus. Okay. So that time go to candidiasis. Okay. Simply you can copy and paste. Okay. Or you can type here. Okay. Candidiasis. Okay. So candidiasis. Okay. Of esophagus. Okay. Esophagitis. So B37.8. Okay. B37.8. Okay. So that time you can give B37.81 as the additional diagnosis. Okay. So one more example, pneumocystitis carini with AIDS. So that time, what is the PDX?
AIDS.
AIDS. Okay. And you can give additional code for pneumocystitis carini. So that time simply copy and paste here pneumocystitis. Okay. So pneumocystitis carini. Okay. So B59. Okay. So you can assign B59 as the second. Okay. So third example, like positive HIV test in patient who is asymptomatic, presented no related symptoms and has no history of HIV infection. Ante only patient ki, so the test result is positive. Okay. So the patient asymptomatic HIV. Okay. Present no related symptoms. Okay. And no history of HIV infection. So that time you can assign G21 or B20.
G21.
G21. Okay. So అలా రిమైనింగ్ ఈ ఎగ్జాంపుల్స్ అన్ని కూడా మీరు రేపటికి చేయాలి. Okay. So I will give almost 12 examples. Okay. So tomorrow we will discuss in deep in this topic. Okay. So in documentation variation, for example, the past medical history only documented HIV. Okay. So that time we can consider as symptomatic. For example, the patient has HIV on long-term use of some medication. So in that scenario, how to go? Okay, so we will discuss. As per documentation. Okay, so we will discuss in tomorrow class. So before that, you complete these examples, guys. Okay, I will share these examples in group. Okay, so first you can read these guidelines first. Okay, first you can read HIV guidelines. Okay, first you can read the guidelines and you can understand the guidelines. Okay, after that only you can practice that examples. Okay, clear, guys?
Yes, sir.
Okay, sir.
Okay, guys, thank you.
సార్ గ్రూప్ లో యాడ్ చేస్తున్నారు యాడ్ చేయలేదు
యా నేను గ్రూప్ యాడ్ చేస్తానండి. నేను రేపు క్రియేట్ చేస్తాను. ఈరోజు లేట్ అయిపోయింది. రేపు నేను గ్రూప్ క్రియేట్ చేస్తాను.
Okay.
అంటే మీకు ఏదైనా మెటీరియల్ రాకపోతే నాకు మెసేజ్ చేయండి. నేను మీకు పంపించలేదా మధు? నేను
నేనే పంపించారు
ఓకే, సరే, పంపిస్తే నో ప్రాబ్లం. ఓకే, థ్యాంక్ యూ గైస్, బాయ్.
థ్యాంక్ యూ